Red light therapy in orthopedics is one of the most common applications, mainly because of the anti-inflammatory benefits of red light therapy and the tissue repairing enhancement of red light therapy. Those are two things that are both functions of the body that are improved by adding red light therapy in. We all want our joints to feel good. We all want to be able to move through our lives without inhibition, without limitation. The limitation on the joints comes from either inflammation, tissue damage, which can come from an injury, or long-term inflammation. And you have tissue degradation, which is when the tissue actually starts to diminish. So the red light therapy, by enhancing cellular function, by enhancing the body's ability to boost energy coming out of your cells, that's going to help the tissue to repair. And at the same time, it's going to reduce the speed of degradation or breakdown of that tissue. So if you're aging and you've already lost a certain amount of disc thickness between the bones in your vertebrae, and we don't want it to go any further, these are the types of things that are going to allow you to maintain the status that you have right now and potentially increase some of the movement. Because in addition to that degradation of tissue, you also surely have some inflammation involved in that area as well. So if we can at least minimize the degradation and reduce the inflammation, you'll have more movement. This is why working with a professional can be very helpful, because we can help you to determine and set expectations for what is realistic.